Nice.
Mm-hmm. Yep. All right, so we're at 9 o'clock on my, yeah, nice to meet you too, Olivia. I think it's probably 9 o'clock for other people too, so we're going to get started. All right. All right, so welcome everybody. I'm just going to do a very, very brief intro to Adobe Connect in case there's anybody here who hasn't used it before. If you're in Google Chrome, it might cause problems, so we just recommend logging in some other browser. The chat pod's here, and we really want people participating the whole time, so feel free to chat at any time. We're not going to think it's rude. It will make us happy. If you need the chat size to be bigger so that you can read it more easily, you can do that with the menu. And you can pick whatever check size you want. It won't impact anyone else. And we're going to ask some polls, or actually we asked some polls, and we'll ask some more polls later. And you just click to respond to them. And then you'll see that you responded because something will be indicated. And so we've got handouts. So look sort of next to Johanna, sorry, where it says virtual coffee. Yep, there we go. If you click on the name of the file and then click on download file, you'll get a little pop-up that says, do you really want to download? It'll double check it. And then you'll have our beautiful handouts, which you'll see in color. I have them here in paper. And it'll just be a little bit easier for you to see. We have slides too, but it'll be easier for you to read the font if you have the handouts. And if you need to log in or log out, then it's just Xing out the way you would close out of a browser. All right, so with that, I would love to welcome Dr. Johanna Creswell Baez and Kristen Renshaw, two of our alumni here from the Columbia University School of Social Work. They're both '06 grads, and they've generously donated their time in rehearsals and materials prep and everything to come here today and share with you some of their research about their program, Wediko. So I will now start our timer here. So I'm going to ask them some questions. So first, can you tell us how you met? Can you talk about how you first met, how you became friends?
Sure.
Yes.
Joanna and I, we met at the Wediko summer program in the year 2000, and it was our first summer for both of us working at Wediko. And I was the athletics instructor, and Joanna was the archery instructor. And on some like special Sundays and a special event, Joanna dressed up and pretended she was Joanna's cousin and made up this character called Disco Daisy. And she like gave all the kids a ton of candy and prizes. And she wore a crazy wig. And I knew then that she was a really creative person and knew how to work well with kids and others. However, we didn't get to hang out that much that year.
Yeah, and likewise, I was noticing Kristen doing an amazing job on the athletic field and working with kids and families, and I was like, I want to be friends with that person. We hadn't gotten quite to the point where we said, I want to start a nonprofit with that person, but we were getting there. We were on the road. And we both signed up for Columbia Social Work School, unbeknownst to each other. And then I was ecstatic that Kristen was also going to be there. And pretty much day one of orientation, we became really close friends. And, you know, we didn't take all of our classes together at first, but then we pretty much started taking all of our classes together. And I was clinical, Kristen was AGPP. But we managed to get on a lot of really interesting classes like community organizing and financial management and program evaluation. And yeah, we started cooking up this idea of starting a nonprofit.
Yeah, I think we really enjoyed being in classes together. We really learned a lot at Columbia, and it made us feel confident about what was coming next. But I think it was kind of between our first and second years at Columbia School of Social Work that we started talking more seriously about starting the Wediko New York program. but it was still a long way off. So that was 2005. We probably started talking about it.
Yeah, and it's been 10 years since we graduated. We graduated in 2006. So it's been a little bit of time. And I think, our financial management course, both of us were, using Wediko for our different assignments. And that course really helped us think about how we could actually start a nonprofit and do kind of some of the legwork that would need to be done.
Great. Well, that leads into my next question, which is, can you tell us about your program? How did you start it, and how did you grow it?
Yeah.
Yeah. Let's see. We had a plan. We had a strong foundation, I guess, with the history of Wediko. We felt like we were on solid ground, starting with all that history behind us and the infrastructure from Boston and New Hampshire. And we had both worked in a couple of nonprofits, and some of them together in New York City. And so we felt pretty clear about how things worked in the city and how nonprofits were funded here and how to build programs. And we also had worked in schools and felt like there was a place for Wediko. There were things that Wediko offered that were not being offered by other agencies.
Yeah. Yeah, really, we felt like originally our executive director and mentor, Harry Parad, came to us. And this was between our summers of our first year and our second year in the master's program at Columbia. And, he said, I've really wanted to expand to New York. I think you guys both have really strong skill sets as social workers. And can you do it? And then he proceeded to have, a 2-hour-long meeting, and there were words like overhead and sweat equity, foundations and grants, and half of the stuff we had no idea what the overhead was one, but I remember writing down on my notepad and saying I needed to do some research on it. But we, after Kristen said, after really working in other nonprofits and seeing kind of the landscape and doing our own research over, maybe it was another 5 or 6 more years, we felt ready to open up Wediko New York in 2011. Do you want us to tell you a little
I know you've got it. I do.
Yeah?
Yep. That's what I was going to ask for, this great picture.
All right. So this is actually... Yeah.
Go ahead,
so
Joe.
Wediko is actually our home base is in Boston, Massachusetts, and the summer program has been around since 1934 up in the woods in New Hampshire, where Kristen and I met. And we opened up the New York City branch in 2011, and this is a picture of us in 2011, year one, in our first school. We started in one school. We had a principal that believed in us. And we were trying to get a grant. So we went out onto, I think it was Fordham Road, and we're wearing these posters saying, vote for us, and we're trying to win a Clorox grant. We unfortunately didn't win that, but we got another foundation to invest in us and some startup funds, the Patricia Kine Foundation, and we were able to get going. And by the end of year one, we were in 3 different schools.
I think, as you can see at the beginning, we didn't know much about PR. I mean, we just taped signs to ourselves. We have a lot more sophisticated kind of materials now and ways to communicate our message.
That is very true. The overall mission, talking about our sophisticated message, is Wediko is strengths-based. We have a continuum of flexible services. We really look to capture success. And we have a strong commitment to applied research and dovetailing that with our clinical work. But our school-based mental health, which is predominantly what we do in New York, we do a range of services, whatever the school is needing. I'll pass it over to you, Kristen.
Yeah, we meet with principals and school administrators up front to kind of show them our menu of services, which you've got in front of you on this slide. and talk about what their needs are. Typically, we stick to the plan that we make at the beginning with very few changes along the way. So it's a combination of individual and small group counseling, case management and resource referrals, home visits, family outreach, and all with the aim of supporting student success. So success for what, right? Academic success, improvements in attendance, um, improving their social and emotional skills and their relationships, their self-management. So it looks different in every school, and if any of you would like to come and visit some of our work, you'd be welcome to visit one or two schools. Probably not this year, but certainly beginning in the fall. So feel free to keep in touch.
And we're always having openings, so check our website for staff openings, because we're looking for qualified candidates to join our school-based mental health team.
So you started with the two of you. Did you have other staff?
Yeah.
Yes.
Mm-hmm.
There were.
And now you're how many?
Now we're 34, mostly full-time staff, and 7 interns.
Yeah, and we have interns from Columbia, and we started with 3 staff. The other person is Hans Bernier. So there was 3 of us in one school, and now we're up to about 35 in 20 different schools across the 5 boroughs of New York City.
Yeah.
Yes, I will echo Alexis in chat, who says awesome.
Yeah, the exponential growth. You saw Kristen kind of go like this. The exponential growth is what we are continually managing. We've had new contracts come in that we're trying to plan for next year, and each year keeps being like that. So people are really wanting these services. Seems like there's a strong need.
I will say one thing we're very proud of is that more than 90% of the schools and partners that we work with want us back again. And with our staff, we did a recent organizational assessment, and across several measures, over 95% of them are satisfied with their jobs and supervision and training and support and being treated as a human being. So I think that Joanna and Hans and I, can be really proud that we started a sustainable, supportive culture.
Yeah, there's lots of supervision, group and individual.
So now I really want to hear about your research. So if you wouldn't mind sharing. Mm-hmm.
Yeah. So like we said, Wediko has a really strong commitment to applied research. Here I am at one of our schools. And we started this, Kristen and I have always been interested in the research, and other nonprofits we were working in, we've always been a part of doing the research. But we really wanted research that helped us in real time, that we're able to get back to our clinicians, our frontline staff, and that's going to help change our direct interventions and our programming. So last year, we started a bigger effort on this, and we were at one school, about 150 students we collected data on. We were looking at their social skills, their problem behaviors, and how trauma really affects their ability to reduce problem behaviors and improve social skills. So here's actually an outline. It was a mixed method study, which is something that I'm specializing in. And there's actually, if you want the handout, we're going to pull it up in a second, but there's a handout that gives you an overview of this. So our research questions. We've got quantitative. Are there going to be pre-post changes in their social skills and their problem behaviors? Qualitative, what are some different themes? So we really believe in empowerment with the students through our research. So we're asking them, how have they improved? How has trauma affected their lives? And we're looking at how those qualitative answers that they give to us, their own words, how that relates back to our quantitative data that we're getting on their social skills or their past level of trauma. So here's the slide. You can see the handout. it might be a little bit bigger if you open it up on your own handout, your own screen. But you can see that we really have theory driving what we're doing. You can see the quantitative first. The quan is our first phase where we're getting data on their trauma, on their social skills and problem behaviors. We get pre and post. And then we follow it up with the qualitative piece and say, bring the data back to them and say, what do you think about this? We're finding out that lots of students are affected by trauma. Do you think that's true? And I'll pass over to Kristen to talk about the ACE survey.
Thanks.
And I think we have some handouts on it. Sorry, some handouts on it too, where you can look at what we did.
Yeah.
So the handouts include this ACE questionnaire in English and Spanish, just to pull it out so you guys know what to look for in your handout packet.
Right. So there's several handouts to do with the ACE questionnaire. The actual questions, 1 through 9, that we used are there in English and Spanish. And then there's also the ACE questionnaire procedure, which outlines the protocol, how to do it, how to ask the students questions in the interview.
Mm-hmm.
And then there's a handout.
Can I pull out the poll?
Chronic trauma
Yes.
affects the whole youth.
Cool.
Oh yeah. Okay. So here's our poll. So if you look at the questions 1 through 9, which of those questions do you believe the highest number, answered yes to?
Yeah, and this is exactly, you might need to make the poll a little longer. I guess they can scroll down. This is exactly the ACE questionnaire poll that asks the 9 questions. And what do you think? We surveyed about 800 students this year at 3 different schools. What do you think that students rated was the highest? Or, what were these different adverse experiences that had affected their lives? The age range, they are middle school students. Do we have elementary too, Kristen, in this round?
No, this is middle school and some high school. The oldest were 9th and 10th graders. And they're in the Bronx and Brooklyn. And that's all the clues I'm giving you.
I'm going to give one clue, which is that there were two answers that got very high scores.
Yeah, the two green ones there, 50% of our students said that this had affected their lives. And a lot of them in the qualitative interviews then went really on to connect these different difficult traumas or adverse experiences with how that affects their school life. So we're able to get in their own words them talking about it, which was really beautiful. And also we're able to take back to our staff to really think about what interventions we are doing with them.
Mm-hmm.
Did everybody vote? Let's see what people said.
No, I think only 2 people have voted. Let me scroll down.
Oh, we've got
more people need to vote.
Mm-hmm.
Oh, there we go.
Mm-hmm.
5.
Yep.
So this is interesting. It looks like if we went by your votes, it would be you've been treated unfairly due to race or ethnicity. And that's great, social workers. Good job. But the students...
That is a reality.
The students were answering that, I think, about under 30% of them answered yes to that question. And, we have a couple of ideas about why they may have said that. And I'm seeing that you're saying the income. A lot of people are knowing that income is going to be a struggle for a lot of these families. And that was another one that kids didn't answer yes to as much as we expected them to. And we know that some of them lied, I guess, or chose to answer no, even though we knew that they were aware of struggles exactly like we were asking about. But for the purposes of the research, we really wanted kids to be empowered, and we honored whatever they said and didn't challenge their answers.
Yeah, you'll see in our procedure that we were very clinical in how we were doing this research. So we had them define trauma first and think about it. It was almost like a counseling session doing this research. And then they took it, and then we talked about resilience afterwards with them and how they can promote it. And yeah, we really took their words, what they said. We did wait a couple of months, so we had developed a relationship, some kind of therapeutic relationship with them to do that. So a lot of these things are stuff that we've learned kind of along the way, and we also wanted to pass it along to other people thinking about administering this ACE survey.
Mm-hmm.
Wediko is an old native.
Oh, sorry, go ahead. I was going to point that out, that there was a question there.
Yeah, Wediko is an old Native American term for shooting star, bringing hope and light to other people. So we had some hippies that started it back. I think the name Wediko came around the 60s or so. It was a different name, and that's why bring hope and light.
I see the other.
All right, so I'm just going to do a 3, 2, 1 count in terms of switching over to show the results. So 3. So if you haven't voted yet and you want to vote, 3, 2, 1. All right.
Great review.
All right. Drum roll. What did students rate? What did 50% of our students rate? 2 different things were adversely affecting their lives. I guess I'm the one controlling this. Sorry. You want to go for it, Kristen?
Yeah. So the one that's closer to the left is being separated, their parents being divorced or separated. So 46% of students said yes, that was true for them. And the other bar that's right at 50% was a witness or victim of neighborhood violence. And again, that was something students felt comfortable saying yes to for the most part. Some of the other questions, I think they were afraid they would get people in trouble if they answered too explicitly. So some of what we may be saying is that these are safer questions to answer.
Yeah, but it was interesting because our qualitative interviews, when we look at that mixed methods, they really did back up this victim of neighborhood violence. Many of them talked about the different, the violence, and they used the words like bad neighborhood and, getting them to talk more and explain that and how it's really affected their lives, from gangs to, I did the second round of interviews 2 weeks ago, and one student was talking about another student dying from gang violence just the other week. So like really intense things are happening to our students, and it was just it would just added a new layer to hear in their own words to kind of back up the quantitative data.
Yeah, I will say also that I see there's a question about domestic violence, and I think that is one of the questions that some students did answer yes to, but we believe the prevalence is higher. So the other thing that happened is, as a result of us asking every single student in the school, almost every student in the school,
800.
They didn't want to be asked.
Students.
We didn't do it. Yeah. So then it kind of like broke the ice. And so then students who didn't have behavior problems or didn't have counselors or kind of weren't identified as needy in any way suddenly had a connection with somebody that they knew they could talk to about these kinds of things.
Yeah, we really.
All right, so we're down to. Sorry, we're down to our last 5 minutes, and I know you wanted to tell us how you use the research. Also, like why did you gather this, and how does it impact your work? So I want to make sure we cover that, and also have time for questions.
Yeah, I mean, what Kristen was saying, she was already leading into it, that just asking students about adverse experiences or trauma in their lives opens up new avenues in our counseling. So we were able to identify students who might not be getting services. We identified students who talked about trauma, but were doing very well in other areas. So we found like a resilient population of students. We were able to then kind of bring that trauma-informed approach to the whole school. And, teachers started saying, we need to know how to work with this. If this is what you're finding out, that they had this trauma. And so we, doing more workshops on trauma-informed care for teachers, working with the whole school system. Really just identifying more needs and helping us shape our programs and our interventions.
The other way that we're using this data is to help school staff understand how to be helpful to students, and why maybe using a very authoritative tone when a student is escalated may not be helpful. So we teach them about trauma, but it's very different when they can see the actual results of the students in their school. There's also research that demonstrates that students who have 4 or more ACEs are 32 times more likely to be diagnosed with an emotional, behavioral, or other learning disability. And so, those classes that we work with have 30 kids in them, and teachers are saying, well, 5 or 6 of them are, in need of help or need to be diagnosed. And when we give them this lens of understanding trauma, they're able to be more effective in making relationships with the kids and then in teaching them.
Yeah, I think we're doing a day-long professional development this Thursday at one of our schools on trauma-informed care. So one of our new schools.
So I see that there are some questions in chat. Eileen had asked, what year did you start, and do the schools you serve tend not to have a counselor?
No, so the schools all have counselors, and actually one of our participants is a counselor from one of our partner schools, Michelle Jervis. Sorry to out you, Michelle. She works at a wonderful school in the Bronx, and she's been working there for a long time. And we really partner with the counselors and social workers at the schools. It's additional services. It's not instead of.
Yeah, and we see them as collaborators in this. So, we're getting this data, we're doing our direct work, we're sitting in on as many school teams as possible that we want to collaborate. And we started in 2011 in one school in the Bronx, and now we're all over.
Mm-hmm. Alexia, one of our new students, has a good question. Culturally specific research is very limited, especially for immigrant and refugee populations. How do you approach that?
Yeah, I feel like we're being thoughtful and, using measures that have been shown to have accurate results. The ACE questionnaire, it was originally started with white kind of middle class individuals, but now has really been tested on a wide range of whether it's students living in poverty or adults in inner city Philadelphia. And so we're using measures that are culturally sensitive and have been tested that way. We're also making sure it's in Spanish and English. And then I feel like that qualitative piece really helps you get at kind of that culture piece, so it'll come up in our interviews where they're talking about, my family is Dominican and this is just how I need to be in school, or, other values, like my family is really important and they're the ones who sent these messages that I need to, whatever. And so I feel like doing some mixed methods work with the qualitative piece helps you really kind of augment your quantitative and do that in a culturally competent way.
I see we're right at 9. Oh, sorry.
I just wanted to say, if you look at the Chronic Trauma Affects the Whole Youth handout, you'll see that there's a whole kind of speech bubble about what else is chronic trauma. So we really try to allow the students to define it in their own terms. And thanks, Johanna or Matea, both of you. You guys are great.
Yeah, so we're working in each layer of what we're doing. We're thinking about that piece, and it's super important working with immigrant and refugee populations. With many of our children that we work with are, first or second generation immigrants.
And some of our staff are, and that's the other way that we try to provide culturally relevant services is by hiring a staff that reflects the population we're working with.
That's true. Yeah, if you look at our Wediko New York website, you can see all of our staff, and you can kind of scroll through and see the range and see how many Columbia alums are on the team too.
So we're right at 9:30, and I know you were willing to share your email address, so I want to make sure that it's up here for people to copy paste if they want it. And Liz McQuarrie has a question about Maryland. Or actually, it's about, do you have any recommendations for presentations or materials? Because in Maryland, schools contract therapists through her organization to provide services in schools, and they want to educate teachers around trauma.
Oh yeah, there's so much good stuff. What is it? Massachusetts Advocates for Children. They have a wonderful resource, 2 free books that you can download as PDFs. I just read another one. This ACES Connection.
I was going to get the link for it that you emailed.
Okay. The ACES Connection one? Or
yeah. I don't know.
For children.
You emailed one today.
I did. I sent out another book today. I think it was called
ACES Connection.
So ACES Connection is this great website, and ACES is Adverse Childhood Experiences, and so everything connected to that and resilience. They're really trying to compile a library of resources, and so they send out daily and weekly emails, which I love. Because it's easy to click. They gather up all the news. But there's also resources you can kind of turn around and use with teachers and schools.
Also, the National Child National Child Traumatic Stress Network is a great website with lots of resources. So you got an ebook, you got a starting, and I agree with Kristen, that weekly digest from ACE Connections is really helpful at looking at some of this current trauma research in schools and students.
When I talk to principals about it, they're like, so what? Not as callously as that sounds. They're kind of like, well, we care, but how would we do things differently? How can we use it to help? And that book that Johanna attached really gets into the nitty-gritty of how you can use this understanding of trauma to inform lessons and lesson plan and responses, not just to behavior, but to learning difficulties. It's often therapists, I think, don't speak the same language as teachers, and so this book seems like a nice middle ground.
I would agree.
So I think we've covered all the questions that have come into chat, but I love all this active participation and sharing of resources, so thank you very much. And I'd like to really thank our presenters today. Thank you so much for taking the time and carving out space for rehearsals and all this practice and putting everything together and sharing your wonderful program with us and teaching us something tonight. So thank you very much.
Great.
Thank you to everybody for joining.
Yeah, it was great to be a part of it. Go ahead, Kristen.
I just want to put in a plug for the Wediko summer program. They are still hiring for this summer, and we have some of the flyers are in the handouts, but please share them within your communities, with your colleagues, on Facebook, LinkedIn. We're trying to get a couple more awesome staff. It's a life-changing position, and it's very gratifying clinically to be able to work with kids in that kind of program. You get to see a lot of progress, and there's a lot more consistency and predictability than there is in most other places. That's it. That's over. But you should do it.
Yes. Life-changing. I second that. I also put up a 2015 article that just came out on trauma-informed social work practice. That's pretty awesome.
Great, and you've got to expand to Texas now.
I know, Alexia, we need to connect. I'm here in Austin. I work from a distance now. So, cool.
All right, well, thanks everybody. We really appreciate your time. And I see some people are typing in, mostly thanks and good night.
Mm-hmm.
And some positive feedback, so thank you very much, presenters.
Thanks, Matea.
Thanks.
All right, and please join us for our future events. If you're interested in school, social work, we've got this conference coming up, and if you're not in New York, you can live stream part of it. And we've got another virtual coffee chat coming up at the end of the month on animal-assisted therapy. Not animal therapy, which it says on the slide. I forgot the word assisted, which is an important word. Yes, mixed methods, yes.
Glad we get to promote it in social work.
Mm-hmm.
No. Awesome. I don't want to
Thanks,
say
everyone.
goodnight.
Good night.
I feel like I'm ready to keep going. having issues with termination.
All right, thanks everybody.
All right,
Thanks.
bye. Thank you.
Bye.